Hello, welcome and kumusta. Thank you for joining me in this episode of OT Conversations. My name is Hao. I am your occupational therapist. In this episode of OT Conversations, I'd like us to have a conversation or have a discussion about marketing in occupational therapy. What is this about? You always hear this on the business side of things, and you wouldn't think that there is a need for us to market the profession, market occupational therapy, but there is. When we are marketing occupational therapy, marketing is about effectively communicating the value and effectively communicating the benefits of the occupational therapy services to our clients, to our patients, to the healthcare providers, to the organization, and to the wider community. This is promotion. This is very important, not only in private practitioners, although there appears to be more of a demand for private practitioners to do this. But this is also important for us people who's working in the NHS, for us who's working in the public sector, in the community, in NHS district general hospitals, and for those of us who needs to and who wants to grow the profession because we want to raise awareness, and if we're asking for funding, marketing is the word. When we're talking about marketing, let's break these things down. What is marketing? It is a system, it's a process of informing people, letting people know about occupational therapy, letting people know about what you do. It is a process of influencing people. It's a process of engaging the stakeholders. And why do we want to engage the stakeholders? One is to raise the awareness of the OT's role in the area. We want to demonstrate the outcomes and the benefits of the things that we do. We want to attract more referrals coming in because more referrals coming in means they are likely to increase funding for us so that we can deliver more and we can get more staffing. And we want to promote the service. We want to promote a program. We want to promote ourselves as professionals. So when we're talking about stakeholders, who are the customers? The stakeholders, the customers. First, patients, obviously. Patients and their families. These are our customers. Even though NHS is a service that is free at the point of delivery, how we interact with them is a reflection us as a person. It's a reflection of us as a professional. It's a reflection of the institution whom we are attached to. So we should always be nice and we should always be friendly. We should always be willing to help. We should be willing to listen to patients and their family. We shouldn't treat our patients like they are a nuisance or they're another job or another work. Yeah. These are our customers. And if not for these clients, if not for these patients who are in need of help, there would not be any occupational therapy. Just remember, guys, we exist because of people who needed help. So they are the first and foremost, they are one of our customers. The other customers that we have would be those people who are referring cases and situations and patients over to us. Perhaps GP services if we're more on the outpatient clinic. If you're working as a pediatric therapist out in the community doing private practice, those people who are referring over to you, they are the customers. In the context of NHS, the GPs, the doctors, the ones that are referring over to you are our customers. The nurses who are seeking help and attention by asking us to look after our patients. Here is a patient who needed to be discharged, for example, they say that, and can occupational therapist please have a look? They are our customers. They are a stakeholder. In a sense, they are asking for us to have a look because they're seeking our professional advice on the matter. Who else are our customers? Funders. If we're delivering research, then yes, we have to promote what we do because they will have to invest on us. Charity, these are our customers because sometimes we put up a post and it's charity that will fund this. And who else? Unfortunately, it'll be the golden rule, isn't it? What's the golden rule? He who has the gold makes the rules. Those people up in the ladder of management and leadership who makes decisions about the direction of the hospital. They are the funders. They are the employers. Actually, the institution, the employer is NHS. It's not these people that looks after the NHS. NHS is alive on its own. Remember that, guys, okay? The NHS is the employer. It's not a manager. The manager is just a one of the tools and one of the cogs of NHS. So the employers, which meant the NHS, the schools, the care homes, the hospitals, the community setting, these are our customers. And also the public is our customer. Why do we say that the public is our customer? The public pays for NHS. And so we need to give back the what is due to the public in terms of professionalism, in terms of respect, in terms of service. Let's now talk about some of the key elements of marketing. When we are talking about OT, we're talking about marketing. And what are the key elements for this? There are likely about four key elements of marketing. The first one is you need to understand your value proposition. We need to understand our value. If you are a clinician, if you are a rising leader in the occupational therapy department, say you're a band 6 going into a band 7 role, you're a band 7 role now, and then eventually going into a leadership or middle management, which is a band 8 responsibility. At the very onset, even as a band 5, we should start learning this. We should learn to understand the value proposition. What makes our service effective, different? What makes us necessary? Like, for example, if you're working in a school, do we help children gain independence in school and in play? If we do, we need to find ways on how we can demonstrate that. If you're working in a hospital, do you help a person get home soon and quicker? If you do, you have to demonstrate how do you help them get home sooner and quicker. That's the challenge. Do you help them get home safely? How do you measure that? So we have to understand and always remember what is our value. The next thing is we need to have a target audience clarity, meaning if we are going to promote ourselves and the things that we do, we have to define the audience and their needs. So, whatever it is that we do, meaning we have to have a clear target audience. Who are we there for? The clients. Who are we targeting? What the service is for? So if you are working in cardiology unit, yes, you'll be working in a cardiology unit, meaning you'll be looking after patients who's had pacemakers, patients who's had stents, frail patients who had heart attacks. How are you going to justify your service to these type of population? You're there. You have to prove your worth. What do you do? Okay. So that's one. And then we need, when we're doing marketing, the third element of marketing is the ways on how we can promote ourselves. Do we do it through digital ways? What's the website, social media? Emails, newsletter. It's very tricky nowadays, isn't it? Because you're seeing after patients, and yet we don't have any arm into promoting the things that we do. Usually it's newsletter, being part of something, be part of any newsletter. There's always a communications department in the trust where you're working. If you're working in any hospital, hospitals love that. They love social media. Be on the website, update the website, which reminds me I need to do that. What other ways and what are the other channels of communication? Do we have an in person promotion like talks, community talks within the organization, talking to GPs, talking to a group of nurses, talking to students, talking to learning doctors? Be there, take part, participate. And the classic way of marketing, which is the old school, which is flyers, brochures, you have case study leaflets. That's that. That's back in the days. But nowadays, there are so many more ways on how we can promote the profession. This OT conversation, for example, is one way of promoting occupational therapy. Okay. I am promoting occupational therapy. I'm not yet promoting any services like a teaching service or supervision service or anything. This is just pure promotion to any of you who are listening. Yeah. So that's one way, a channel of communication. And the last of the key elements of marketing is messaging. When we are delivering message to our patients and to our clients, we need to use the client centered language, a language that is tailored to be understood by our target audience. What are the outcomes? If we are presenting outcomes to doctors, then we try to make it in a way that they can understand this. The real life success stories, patient stories, those that pull the heartstring is so effective. And if we're talking to the public, then we should be avoiding jargon. So the level of communication that we need to use should depend on our target market. For example, we can say, for example, if in a group of professionals and OTs and therapists and nurses, for some who's very high in the position of the scientific world, they would say, they always look down on therapists. So you have to speak in a language that's a little bit more technical. So, like, for example, we as occupational therapists, we provide task analysis and environmental adaptation. So that's how you want to do that. Our training program is a performance component restorative program. So that's something that we can use, or neuro rehabilitation techniques and facilitation strategies. That is the language that they would tend to pay attention to because it's something that they do not probably understand. Equally, they would bombard us with some medical terms, which for a therapist who's doing its job, these medical terminologies would not scare us a bit. Okay. The other thing is, say, for example, on the other hand, if we are talking to clients and to people who does not have a lot of understanding on the medical field, then we can say we help people return to activities that matter to them. Yeah, so that's the messaging. So what are the strategies that work in occupational therapy? What are the best ones so far? So some of the strategies involve testimonials and case studies, narrative stories. I keep on saying this. This is so powerful when somebody from experience is speaking on behalf of you because you've done the simplest thing of pulling a chair for them so that they can sit near the window and that they get their sunshine therapy. Wow. And they will see that as an act of kindness, a genuine act of kindness, and them speaking on your behalf is so powerful. So that's a strategy that worked. Another one would be partnerships. So this would be service level agreement. So collaboration between GPs and the schools and community groups. When you are tied up to one organization, for example, these are all partnerships. Every time there is a campaign that they would do, they would invite you as occupational therapist. Say, for example, mesothelioma, for example. There are charities for these things, and motor neuron disease charities, heart and lungs, British Heart Foundation. So all of these charities, if you have a good tie-ups with them, which normally we do, your local charity in the hospital. So just tie up with them, and there we go. You'll always be there. They will always invite you to speak. We can go and take part on educational events, either by teaching, educating people about some things about occupational therapy, doing webinars, or we can host workshops. That's something that we can do. And another one would be a referral pathway by making it easier for others to refer clients over to us. So having a good referral pathway, that really just works. Imagine a 2 case scenario where one referral, one pathway is that you don't see a patient unless a nurse sends over a written referral over to you. So all of that work will stop a nurse from sending an early referral because they have to do it. The tendency is that the nurses will delay these written referrals over and over again. They will delay it up until the last minute. And by the time you receive that referral for the last minute, the patient's been seen by physio, they knew the story, everybody's recommended something, everybody knew the patient apart from an occupational therapist. And so, in the end, a rehab assistant who's seen the patient sooner than you would have said, "Oh, OT, can you just please give a commode?" Because that's all they need. And here you are, a qualified therapist, going into the computer and making some orders. Okay? Oh, man. That's a little bit sad. But, anyways, just make that referral pathway easy. So, that where a person needed to write down complex referral procedure as compared to somebody who can just call on you and raise a name. Can you have a look, please? I know in our education system, there is that process of referral, like data gathering, referral, and then assessment, problem ID, treatment. Yeah, but referral is by can be done in many ways. It can be done in a written referral, particularly if somebody is in a GP where your office is different. But you can have a referral by asking and by phone calls as well. That's another way of doing it. Verbal referral is also fine. You just have to log these in, okay? So make yourselves available. And then the other strategy that worked for OT marketing would have been the outcome data, which means that every now and again, it has to be regular, periodic. We have to share the measurable impact, improved ADL scores, and discharge success. all the time, all the time. This is something that we need to do. I have been saying this over and over again. But if you look at some literatures, look at some management books, it's there. I am not pulling this out of nowhere, guys. It's there. So for those people who has encountered me in real life, and I'd be preaching about these things to growing OT, meaning those who are, say, newly band 7, or those who are acquiring more and more leadership roles. I keep saying this. And my experience is that there is a reluctance to listen to what I'm saying. I don't know whether is it me, is it the delivery? Sometimes you make you think about that. But even the leaders who just went up the ladder, sometimes you think about that. They don't think like that. As an occupational therapist, they don't think about marketing. Yeah. Okay, there you go. So some of the strategies that work, let me summarize that again. Through testimonials, you can have partnerships, some educational events, referral pathways, outcome data, present that. Now let's talk about some of the ethical considerations when we are doing some marketing. Obviously, you have and we have to follow the professional code of ethics, particularly in the code of veracity, which is truth. We shouldn't be doing exaggerated claims like a most recent president of one country in our current time. Lots of wonderful claims. It's beautiful more than anybody else. You don't do that. Okay. That's a lie. So that's unethical. That's wrong. Okay. When we're doing some marketing as well, you have to protect the client's confidentiality. So you can use a case, you can talk about a case, a situation, but there should not be any identifying parameters on cases that you use, because really, why? You know, the person is important, their privacy is important, their situation is what matters, because from their situation, that's where people would learn. And that's a case study in a sense. Yeah. And what else? If you are going to use people and social medias, for example, then there are some consents and there are some formal consent forms or consent strategies that we can utilize. So just remember these ethical considerations. Another thing when it comes to ethical considerations would be the cultural differences. So we have to be respectful of the varying the cultural references. Okay. Because there might be some culture who does not want to be seen having having problems with or presenting themselves with disability. So it's taboo. Now, let's go back to some of the tools. Let's talk about some of the tools that we can use when we're doing marketing. There will be a lot of things out there. You can have lots of digital platforms out there. It's one of them. So you can have plenty of websites, web spaces, web pages. But if you're working for NHS, there is usually a digital platform that you can use, written up materials, just finding out ways on how you can translate these stories into digital platform. There you go, guys. I hope you like this conversation. What happens though? Let's have a talk. If we're talking about occupational therapy in, say, in an acute hospital facility, we are always advocating. Just remember, you're always advocating early for early OT involvement. That's what you need to promote. Early OT involvement. We need to ensure OTs are included in the discharge planning. If you're there on the discharge planning, then you are seen by a lot of people. So our participation in discharge planning is actually very important in promoting the profession. Yeah. And I know a lot of people don't like to do discharge planning because it is beneath us. Some people think it is beneath us, but it's not. Think of it as an effort to promote the profession. We are always trying to justify the staffing levels and service expansion. We always have to think of ways. If there is a service, yes, we can help, but we need more staffing. We need more staffing because if we have more staffing, then we can help even more. We can see patients even more. We can discharge patients sooner. And when we can discharge patients sooner, the service can do more. And when the service can do more, then it gets more. And we are always enhancing our interdisciplinary collaboration. That's why it's always better to be seen in a whiteboard meeting. When you're there with the team, they know that you're part of the team. Every time there is a meeting, a business unit meeting, be there. We can always educate as to how occupational therapists have been contributing to the reduction of the length of stay, although this is very challenging. And although I'm sure it isn't in other areas, there's one case that I just remembered when there was a delay, there is a bit of a blockage of discharges, right, in one hospital. And the senior managers, this is like the A team of the discharges. When these managers in coats come down means, oh, this means business. So they came down. And then the first question that I heard was, why is there a delay in discharge? How come there's no patients that are being discharged? And this is what the person said. Do we have any OTs around? Yeah. So there you go. So it's good because that person, through that their length of experience in managing the hospital, knew that occupational therapist is very important in getting the situation flowing, right? Another one case scenario, if I'm not mistaken, the person who's been in the longest in the hospital, 21 years or so. Again, a friend of mine in London, she's in high level management in one of the big hospitals in London. And she identified, she was told that the person who's been in the hospital for a long time is 20 or so years, 19, 20, 21 years in the hospital, only managed to get home because they got an OT involved. There we go. In a recent situation where I am in the most recent days, there was one complex discharge in the sense that the person no longer need to be in the hospital. Person is medically fit, but the person has some memory problems. He has dementia, and the wife cannot look after the patient anymore. The patient was physically independent with their personal care, and the only thing that the person needed was a verbal prompt, but the wife just could not do it anymore. And the wife, in many occasions of recent admissions to and from hospital of her husband, just was on the breakdown and couldn't have the person anymore because of the very bad memory problem of her husband, very short-term memory impairment. And if we look at the situation, the patient was independent, only needing supervision. There appears to be no need for any OT involvement anymore. It should have been done. However, because of the complex nature of the discharges, some of the social services, the community, the nursing homes, they were like calling, and there's just nobody making these clear clear story as to where, what, how, what needs to happen. And all the OTs have been having is just like sporadic information here and there, but nothing gives a clear picture. So, what I did was I have spent a lot of time. I've completed a very thorough functional status report, one that tells the story so that anybody who has questions about discharge, about the person's abilities, about the worries of the wife, about the home situation, everything's all answered. And it was all answered in a functional status report that I completed. And then I was asked by one of the staff and the occupational therapist saying, "Oh, why did you do it? You're wasting your time." I wasn't wasting my time. I'm actually saving a lot of people's time by consuming my time. I have saved up a lot of time of social services, social worker, the nurses, the doctors, the discharge planning nurse, anybody who has worries, I have addressed by using up my time. So it was not a waste of time. And there you go. By doing that, we or I was advocating for occupational therapy. What do we want to do sometimes in a hospital? What's the best way on how we can market occupational therapy? We can craft simple, powerful messaging that aligns with the outcomes of OT and it aligns with the hospital priorities. For example, we can always say OT can be in within 24 hours and we can conduct that study. We know that if an OT is in within 24 hours, it reduces the length of stay by, you can measure that certain amount. Yeah. Or we can promote and say, we as occupational therapists, we enable safe, confident discharges, not just the quick ones. Yeah. Or we can say, we prevent readmissions by addressing home safety, by addressing the cognition, by addressing the function. And without occupational therapy, medically fit patient may stay an extra 3 to 5 days waiting for rehab planning. That is quite true. Yeah. Because OTs, we are ambassadors of these patients. We're not discharge planners. We just know. We just look at their medical condition. We look at their functional condition. We look at their family. We look at how they're performing with physiotherapists and how they're performing in the hospital, whether it's going to be safe or not. And we are the ones that are on top or should be responsible for a person's ADL engagement and ADL abilities, whether or not they need to go to a rehab or not. It really relies, a lot of it relies on us. And we are one of the trusted source of information because we can tell whether the person is safe or not, physically able or not. We can tell whether the home environment is suitable or not, right? How else? How else can we promote occupational therapy? We can promote some of the strategies that we can do. We can create visibility on the ward. Yeah. How do we do that? You can write down, update the whiteboard, keep the whiteboard busy. Yeah. Add an OT status column so that everybody would be looking at it. Lots of hospitals have done that. I have worked in about 20 or so hospitals in the United Kingdom, and it is a theme. Whiteboard is a tool. As a locum, I pop in, I populate that. It minimizes that chat, that chit chat. People are aware that we are involved. Be proactive, see the patients early. We can put down bedside posters, for example, if you're allowed to stick something up the wall. Like, for example, ask your OT, how can I get home safely? Things like that. Or we can do a daily round, the OT rounds. We can be vocal, we can be concise, we have to be visible. We have to present our contributions confidently. We can do our own rounds or we can take part in the daily rounds of the doctor. So you're there listening to the doctor. Because at the end of the day, the patients are the doctor's patients. So while they're looking after the impairment, there will be some psychosocial factors that will be impaired. There will be some physical and functional problems based on those impairment. And the doctors can't prescribe medication. The doctors will prescribe occupational therapy. Occupational therapy is something that can be prescribed. And when they prescribe it, it means that they're referring things over to you. Almost synonymous with referral is prescription of occupational therapy. Okay. The other thing is have a uniform branding, which is we're quite good at that. Occupational therapists are very synonymous with people who are wearing green. And that's amazing. In Ireland is wearing green. United Kingdom, OTs are wearing green. When I landed in the Republic of Ireland from the country where I was from, OT was not associated with green. We were wearing scrubs and we were wearing maroon, never green. Yeah. So that's good. So OT's been identified with the color green, uniform branding. And then you can have some campaigns like Functional Friday campaigns, where we invite MDT to focus on functional assessment with us. That's a good one, isn't it? I've done it a grand round, ground OT. So grand OT round, very quick. I've done that initiative a few years back when there was a lot of us, when there's a weekend working. We just look at the ward, all OTs walking together, looking at the clients on a Friday. And in a very quick round, we were able to identify which patients needed seeing and which ones were active, which ones weren't. And that was it. I think we should wake that up again. The grand OT round. Few more strategies would include educating MDT members, other colleagues, lunch and learn lessons. Have you heard of that? So it's a 15-minute pop-ins to junior doctors and nurses. How can OT speed up? These are to-do lists, guys. Lunch and learn or case-based flyers, for example, one-page laminated success stories. There we go. Disseminate it. New staff inductions, which would contribute a 5-minute OT talk. Yeah, I've been regularly invited to stroke talks and stroke conversations and students and doctors. There you go. These are all very helpful initiatives through education. We can influence the discharge culture through joint assessments, visual dashboards. Wow, that would be a nice thing, isn't it? A visual dashboard and OT in discharge meetings. We can also collaborate with the business leaders or senior leadership, and we have to present. We have to present a OT business case, learn how to do a business case. Meaning, if we increase the OT cover in the weekends, we'll reduce discharge delays. Or one whole time equivalent OT in emergency department, for example, will prevent 20 admission days per month. Imagine that. And these admission can be equated into costs. And now you just have to weigh the cost of OT service and the cost of the efficiency that's being saved. We can also invite some of the executives to shadow OTs for an hour while we're seeing patients, doing some therapy. Yeah. And like I said earlier on, we have to contribute to discharge or hospital letters. Right. There you go, guys. There is a lot to be discussed. We've just spoken about marketing, some of the parameters about it, lots of things. It all boils down to us being important, knowing that we are important, knowing that what we do matters. Important in the sense that we are a vital service that can help the patients. We're a vital service that can help the institution, and how we're helping needs to be shared. We need to be able to contribute. We need to be able to justify. Advocacy is a marketing responsibility of all occupational therapists. Okay, there you go. If you enjoyed this talk, have a conversation amongst yourselves. Talk about it over a cup of tea. Learn together and grow together. If you feel that this has helped you, think about the others. Think of perhaps I could be helping others too. And you can do this by sharing these podcasts, liking, subscribe, and do what you do to appease whatever algorithm is out there. Just remember, guys, anything you do matters and has an outcome. Until next time, bye.